Gallstones and gallbladder cancer are often talked about together. So let's sort it out without freaking out. Yes, most people who develop gallbladder cancer have had gallstones at some point, but only a tiny fraction of all gallstone patients ever develop cancer. It's like headaches and brain tumors. Most people with brain tumors have headaches, but only a tiny fraction of people with headaches have a tumor. Same logic. Now, geography does shift the numbers a bit. In most of India, especially the south and west, the lifetime cancer risk from silent gallstones is less than 0.3%. That means less than 3 out of 1000 people with silent gallstones get cancer. In the Gangetic belt, UP, Bihar, rest of the north and northeast, it's a little more, around 1 to 3% over a lifetime. Bigger than the south, but still very small in absolute numbers. So, when do silent gallstones become a real worry from a cancer perspective? When they are large, more than 3 centimeters, when they tightly pack the gallbladder, when there are associated polyps, and when they have been sitting there for years causing chronic irritation. So, the question now is, should the silent gallbladder with stones be surgically removed or not? Here's the math. The potential risk of death from gallbladder surgery is about 0.1 to 0.2%. The risk of a major complication in this surgery is roughly 0.3 to 1%. So, for a young patient in a high risk region with big long standing silent stones, the surgical risk is actually lower than the 1 to 3% lifetime cancer risk. In this setting, surgery may be justified. But in the low risk regions like South or West India, annual ultrasound surveillance can be quite safe than operating on silent stones. And here's the irony. Even in the high risk regions, people or sometimes doctors panic over a 1 to 3% lifetime cancer risk from silent stones, while casually ignoring the 10 to 25% lifetime cancer risks from daily smoking, gutka, heavy alcohol use, or obesity. Those kill far more people. But somehow, even in patients with these other risk factors, those mute gallbladder stones get all the attention. I genuinely don't understand this selective ignorance. So, the bottom line is simple. Most people with gallstones will never get gallbladder cancer. But in the right setting, big stones, long duration, chronic symptoms, or high risk geography, the risks become more relevant. And that's where thoughtful, personalized decision making matters. This is gut instincts, where clarity beats fear, and the right information leads to better choices.